what's your reaction to what the head of the CDC just said there?
Hi, Emily. Thanks for having me today. Yes, I think this is a really critical moment for the US to be able to combine the mass rollout of vaccinations with continued testing. And in addition to that, just the behaviors that we've all adopted over the last year. We have so much ahead. We have the promise of a new dawn, but being able to stay safe during this vaccine acceleration, I think, is of the utmost importance. And testing has stagnated because people aren't going to get testing as often or as frequently. And yet the testing modalities have really improved. Most people can get tested within the day or within a couple of days. The FDA has rapidly approved new formats of testing as well. So just another voice of caution to say, if we stay the course for another few months, I think we have a bright future ahead.
So talk to us about the demand you've seen over the last year. You were one of the first companies that was approved to do home testing kits. Many people took advantage of that, and now it sounds like behaviors are changing.
Yeah, absolutely. EverlyWell was in a position to be able to innovate quickly and to serve at a national scale. And many companies have been able to follow suit with the FDA's quick work and making sure that we ramped testing after the initial slowness. However, what we're seeing is a lot of employer demand and a lot of university demand and state demand, but individuals are not going to get tested as often, largely because I think there is pandemic fatigue, which is totally understandable. But what we're seeing across the board, and I think you hear it from testing rates as well, which are published, is the testing frequency is just declining. And as long as people are quarantining and exhibiting those behaviors, maybe that's okay. But as you can see from the CDC spikes over the last 7 days in cases, that is not what's happening across the board. And so even with new things like DoorDash and Tinder and at-home testing going mainstream across the board, I think it is really challenging right now to have this right combination of vaccines and testing to make sure that we contain the pandemic.
Julia, talk about this future of the category at-home testing and telehealth, which you helped create. You've just done these 2 acquisitions. What does this look like post-pandemic? We've got about a minute left.
Absolutely. So EverlyWell has been in home testing for 5 years, and we've acquired 2 companies, a 50-state telehealth network and an at-home testing company that supports payers and Medicare plans. And as we've really led the way in creating the $300 billion diagnostics-driven telehealth space. And we see a bright future in supporting our nearly 400 clients, major labs, retailers, health plans, and being able to do that moving forward. Healthcare, including diagnostics, is in a watershed moment post-pandemic, and we are leading the way in supporting with digital care. And I think there is a bright future ahead as patients demand better and as people demand better services coming out of the pandemic. That is a silver lining for sure.